For this lesson, we're going to discuss the chronic conditions of neuropathy. This is not necessarily a disease, though it can be attributed in some cases to a specific disease. Instead, neuropathy begins with a damaged nerve that doesn't properly communicate with the brain. It can start as numbness or tingling, but for many, it manifests as pain in the affected or injured area. For many people, this pain will vary in intensity throughout the day, which can make it tough to treat. Dr. Bearman, can you tell us a little bit more about the condition, how you've seen medical cannabis help those who live with it?
Peripheral neuropathy is a condition that responds well to cannabis. Peripheral neuropathy, as you pointed out, comes from nerves that are damaged. The nerves may be damaged by injury, a physical injury. They can be damaged by atherosclerosis, which often accompanies diabetes. They can be caused by degenerative nerve disease like multiple sclerosis. Any one of a number of these can cause the nerves to operate in an abnormal fashion that causes them to transmit pain signals to the brain. So the question is, what do you do about that? Many of these are caused by inflammation, and since the cannabinoids, several of them are anti-inflammatory agents, many of the terpenes are anti-inflammatory. In addition, you also have cannabinoids and terpenes that have analgesic properties. So peripheral neuropathy responds quite well to cannabis. GW Pharmaceuticals in the United Kingdom started doing research on tinctured cannabis in 1999, looking at peripheral neuropathy in people with multiple sclerosis. I and a number of other cannabinoid medicine specialists have a number of patients that have peripheral neuropathy related to diabetes. And diabetes is cause of peripheral neuropathy in many, many people. So the use of cannabis can be really helpful. Here again, I think that you need to use the whole plant. You need to take a look at CBD because of its anti-inflammatory effects, and you need to take a look at THC because of its analgesic effects. Also, as we've said previously, you have to take care because there's no one size fits all. Again, you'd like to start with a relatively low dose, probably 1-to-1, and then slowly increase and see whether or not you can find the spot, the dose at which you get maximum relief with minimum side effects.
Dr. Bearman, I have a couple questions that came in from our audience surveys. Can CBD be used to help regenerate the nerve or heal damaged nerves associated with neuropathy is the one question. And the other one is cannabis relief temporary or potentially curative?
Well, cannabis can help repair the nerve. If the nerve has been damaged as a result of an autoimmune attack on the fat, it can stop the autoimmune attack and the body can repair itself and put the Schwann cell back in the shape. In regards to the effect on the nervous system, there are studies that show that it may be beneficial in regenerating new nerves, but I think that's speculative, and exactly what that means isn't 100% clear. On the other hand, it's not likely to cause you any harm, and that's the first rule of medicine: first do no harm. So I think the idea of people that have neurodegenerative disease, that the use of cannabis is something that can be helpful because it will deal with the problems of pain and muscle spasm. It also appears that it will slow down the progression of that disease. Whether or not it can reverse the disease is hard to say, but if you take a look at diet, for instance, with people with type 2 diabetes, if they lose weight, a lot of weight, 30 pounds, 50 pounds, 60 pounds, their diabetes will usually go away. Their high blood pressure will usually go away. And it is within the realm of the possible, although I wouldn't hold out a great deal of hope, that their neuropathic pain will improve and increase. At the very least, it's not likely to get any worse if they are able to get their fasting blood sugar within the normal range, which they can do by losing weight, by watching their diet, by not eating a lot of sugary foods and carbohydrates and that sort of thing. I don't think I want to hold out the idea that for many people that the CBD can actually cure the problem. However, it can improve things quite a bit, and it may improve them to the extent that people do find that their symptoms have disappeared. This is because of the anti-inflammatory effect of CBD, and that many of these nerves are injured by having inflammation. They also can be injured by having an inadequate blood supply, which causes the death of some of the Schwann cells, the fat cells that are around the nerves. And if you can get those Schwann cells back to health, then you may be able to, if not reverse the process, at least stop the process in its tracks.